very sudden, acute, severe abdominal pain or pelvic pain that will be so serious with fever, the leading impression will present in the hospital. Good day, everyone. This is Dr. Yakub, Wildlife Hospital, Abuja. Today, in the series of our health talks, we'll be talking about STIs, that is, sexually transmitted infections. In this case, in people who are sexually active. So, what are sexually transmitted infections? Well, as the name suggests, these are infections that are exclusively contracted during sexual activities, and there are a number of them that we come across. In this list, we have parasites, we have fungal infections, we have bacteria, and then we have viruses. So now for clarity, I'll just mention them and mention the class of organisms they belong. But I'll start from the very big one and go down to the ones that probably have long-term significance and especially reproductive significance. Among the ones we are very commonly familiar with, we have HIV. The HIV is also considered as sexually transmitted because, of course, one of the major ways of transmitting HIV is during sexual activities. Then hepatitis B, and of course hepatitis C. But hepatitis B also can be contracted sexually as well. Then among the fungal infections, the one that is very common is candidiasis, yeast infection, also considered a sexually transmitted infection. Then we now have the parasites. Parasites are those ones. There's this particular one we call Trichomonas vaginalis. This is also considered sexually transmitted. Then we have bacteria. There are two of them that are notoriously sexually transmitted. So we've heard of Neisseria gonorrhea fever, and then Chlamydia trachomatis. These two are the two bacteria that we know are considered sexually transmitted. We already said that these infections are gotten through sexual activities. What are the symptoms? I'm not going to probably talk about HIV, hepatitis, because these are very huge things to discuss in their own right. I'll probably come down to just three of these things or four of these infections, and then discuss them in bits and details. The first is the Trachomatis vaginalis. Trachomatis vaginalis is a parasitic infection that affects the cervix. The cervix is the neck of the human. Usually it comes with, it presents as very foul-smelling vaginal discharge associated sometimes with itching. The discharge is usually classically greenish in nature, and there's also itching and has this fishy smell that may come with it. That's Trachomatis vaginalis. It's a parasitic infection. Then Candida yeast infection, the way it presents is itchy, also itching in the genital tract, and most of the times it's cheesy, thick, whitish vaginal discharge that may be associated with that. So those two, Trachomatis vaginalis and then Candida, those ones present with some form of itching and some kind of vaginal discharge. The ones that don't usually come with itching or some kind of vaginal discharge, and the more problematic ones are the bacterial types, the Neisseria gonorrhea and then the Chlamydia trachomatis. These two, in most cases, women who have it are not aware they have it. But once in a while, particularly the Neisseria gonorrhea, when a woman contracts it can come with very sudden, acute, severe abdominal pain or pelvic pain that will be so serious with fever that the woman you present or the lady in question will present in the hospital. And following few examinations here and there, few diagnostic procedures, the diagnosis will be made and then treatment given. However, most women who have it don't know, and so because they don't know, they don't present in good time, and so therefore with time, the persistence of this infection in the genital tract tend to damage certain parts of the reproductive system, particularly the fallopian tubes in this case. Chlamydia and gonorrhea are very notorious, especially chlamydia. They damage the tubes over a long period of time and ultimately into blocked tubes and the rest of them. And so those ones are the ones that we consider, especially in fertility cycles, as the most dangerous, because these are the ones that come insidiously with those ultimate complications of blocked tubes. Now, how do we make diagnosis of sexually transmitted infection? It is important that when you suspect you're having one of these things, you present yourself to a doctor, appropriate facility, so that appropriate things will be done. These investigations may include whatever it may include an ultrasound scan, and may include taking swabs from the genital tract, either high vaginal swab or what we call endothelial cervical swab. Sometimes the absence of organisms or growths from these swabs may not necessarily exclude these things. Sometimes certain tests like laparoscopies can be done, especially to diagnose the cases of gonorrhea or chlamydia trachomatis. So most of these things, once diagnosed, then appropriate treatment is instituted. But we have to take note of the fact that the absence of culture positive bacteria in the specimen does not necessarily exclude sexually transmitted disease, because in most cases, some of these organisms need special environment, what we call special media, to be able to culture them in the first place. So it's important that when you suspect them as a native, please go to the hospital, get properly investigated and properly treated. For healthcare professionals, they have criteria, they have certain steps they take to make sure that they make appropriate diagnosis for these conditions. And once this is diagnosed, then it is treated. It's important that we emphasize the role of chlamydia and Neisseria and gonorrhea in reproductive treatment. Once you suspect it, it is better you clear it on time so that you do not allow it to stay in you for too long to the extent that it eventually damage, or any one of them eventually damages your tubes. So therefore, whenever you're sexually active and you suspect that you have any one of these, please avail yourself. So by and large, sexually transmitted infections are many, but the ones we want to emphasize upon are the most commonly the salient ones, as I mentioned, chlamydia and the gonorrhea. These ones sometimes do not come with any symptoms, and they're the ones that have future reproductive implications. Thank you very much.